Good morning, everyone. Thank you for joining the KNHUON webinar. My name is Dr. Maureen Kinge. I'm a pediatrician at the Department of Pediatrics and Child Health, and I'll be your moderator for today's symposium. This week, we are having the Mindweek Symposium. We'll be covering various topics related to developmental and mental health, as well as hearing among children, especially those who are affected by HIV. Today we have an extremely unique and interesting topic to discuss, and we'll be covering father engagement. Often they've been in the background of interventions that influence maternal and child health, but they're a very important pillar that is often overlooked. And so today we have two amazing panelists who I've had the pleasure of working with. We have Helen Mora, who's a researcher and a coordinator of various studies in KNH Research and UW Kenya, and Dr. Michelle Bulteris, who's an associate adjunct professor at the University of California, San Diego. So our first discussion will be led by Ms. Helen Mora, and I'll introduce her. So Helen Mora works at the University of Nairobi, and she received her Master's of Public Health from the University of Washington in Seattle. She has been a coordinator on the HOPE study since it began over 7 years ago. And she also supports several qualitative studies through planning and undertaking data collection and analysis. Her research interests include improving pediatric and adolescent HIV outcomes and scalable mental health interventions. And I will tell you for a fact that that introduction does not do her justice. So I'll let her tell you a little more about what she does and what she has for us today. Thank you. Karibu, Helen.
Thank you so much, Maureen. I am very honored to be part of this conversation this evening. And thank you for such a wonderful introduction. I think you covered everything that I would have said. And yeah, I'm really excited about the topic of father engagement. And I look forward to sharing that with all of you tonight, today. I know for some people it's in the morning, but here in Nairobi it's in the evening. So thank you so much, Maureen.
Thank you, Helen. I think we can begin. In case you have any questions during the presentation, kindly put them in the Q&A box at the bottom, and we will address them at the end of the presentation. I think you can go ahead, Helen.
Yeah. Okay, so thanks everyone again. My name is Helen Mora, and I will be, today we are talking about fathers, both from their own perspective as well as that of mothers. We will very much amplify the voices of the fathers, but we will also hear some of the perspectives of mothers. I would love to introduce the topic of fatherhood using these two photos. And these photos were taken during the HOPE qualitative study that was conducted in Nairobi, still ongoing. These two photos speak to two things. One of the fathers is speaking to what being a father means, and another father is expressing the challenges that fathers face. I would like to start by briefly introducing the HOPE study, the larger HOPE study, where these fathers and mothers that we will be hearing their perspectives today were drawn from. So in this study, one of the cohorts in this study has 2,000 mother pair infants who were recruited both in clinics in Nairobi and in Western Kenya. And of these 2,000 pairs, half of the families are affected by HIV. And so we have 1,000 mothers living with HIV, meaning their children are exposed to HIV. And we have 1,000 mothers who are not living with HIV. And so we are referring to the children as HUU, or children not exposed to HIV. So for these families, one of the things that we were looking at is developmental outcomes. And this follow-up was done every 6 months until the children were 3 years. And most of the children will be completing the study this month. During this study, one of the things we noted that, or some of the things that we noted that really motivated our desire to explore further engagement was that on developmental assessments, gross motor scores were lower among children exposed to HIV. And when we looked at the family dynamics of mothers living without HIV, we found that further engagement and relationship satisfaction was higher in that population. And notably, further engagement and relationship satisfaction was associated with better developmental scores at 2 years of age. So knowing that, we set out to explore further perspectives on their engagement and strategies and interventions that can promote healthy further involvement. And also, using the nurturing care framework, we explored, parenting perspectives from both mothers and fathers. And this was an entirely qualitative study. I will highlight that in this study, a similar study was conducted in Botswana, but our focus will really be the study that we conducted in Kenya, and particularly in Nairobi. Our Western Kenya participants were not included in this qualitative part of the study. And so we had 2 components in our qualitative study here in Kenya. We had the focus group discussions, and we had photo voice, which I will describe as we go along. Towards the end of last year, we had 6 focus group discussions, 3 with mothers and 3 with fathers. And for mothers, we were considerate to group them by HIV status, which was not the same for fathers. The photo voice groups are ongoing, and I will be sharing some interesting photos from that exercise. Looking at this, remember the first objective where we explored parenting or caregiving perspectives. We used the nurturing care framework. The nurturing care framework is basically a roadmap that was developed by WHO and UNICEF that provides guidance for supporting early childhood development, especially in the first 3 years. And these 5 domains of the framework propose that children will thrive when care is sensitive, responsive, and developmentally appropriate. So for this study, we did an interactive activity, both with mothers and fathers, to get perspectives on this framework. As you can see, there are 5 domains. And like I said earlier, these 5 domains, if adequately provided, then the children will developmentally thrive. For this activity, the interactive activity using the nurturing care framework, during the focus group discussions, the 6 that I mentioned, we gave the participants the colored stickers that I have shown there. So they were to use these stickers to, put them on the domain that the blue was for the most important domain, the green for the easiest to provide, and the orange for the most challenging to provide. I just want to give a small peek into the Botswana data and how it compared to the Kenyan data. And remember, in Botswana, it was for this exercise and the focus group discussions, it was all mothers. There were no fathers involved. So comparing the Botswana mothers and the Kenyan mothers, we see that there was one of the domains that the Botswana mothers found easy to provide was responsive caregiving, while the mothers in Kenya found opportunities for early learning easy to provide. And this could be attributed to the differences in age. The Botswana mothers were participating in this study when the children were much younger. The children were approximately 6 months, while in the Kenyan children were between 2 and 3 years. So we see those differences, and we could say possibly attributed to that. Now, moving on to our participants here in Nairobi, and how they looked at the different domains of the nurturing care framework. We have the mothers and the fathers. And overall, we can see that the mothers and fathers in our study were noted that their most important domain was the physical and mental health. Now, to amplifying a little more the fathers' voices, for the fathers in this study, adequate nutrition was fairly important to them. And while they said the most important, just like the mothers, was the physical and mental health, and some of the things they said to justify that, they said it's not simple, because if the mind is troubled and the overall well-being of the child will suffer, or if, they are also speaking to if there's conflict at home or there's no peace at home. Those that felt what they said about learning opportunities, the fathers, was that, and this was also considered a fairly easy domain to provide, that teaching children, gives you an easier time because you don't know tomorrow. So kind of like preparing the children for the future. And that's a domain that was considered relatively easy. Again, considering these are 2 to 3 year olds, I guess these are children that are quite curious and, wanting to learn many things. And so the fathers actually felt that this was an easy domain to provide. One of the things that they pointed out was the domain of security and safety was quite challenging. And, they felt that they were not always there to ensure that the child is safe. The child could be out, the father could be, away from home. So they felt that they didn't have control over this domain. And so they identified this domain as the most challenging to provide. Coming back to nutrition, and we will see a little bit of this a little more as we go to the second component, which is the photo voice and what fathers say. So for the fathers, they felt that this was, while proper nutrition is important, as you can see with the blue stickers, fairly important, but, unstable jobs and inconsistent family income does affect that domain. So some of the fathers pointed it to have some challenges. I would like to switch now and talk about the second component of our qualitative study, which we used different methodology. The first one, we were doing focus group discussions, and I have highlighted the results from the nurturing care framework. For the second component, we used a slightly different methodology, and this is a community-based participatory method that is visual, and also, uses photos and narratives to explore and experiences and different perceptions on different things. So, and it has been fronted to be a method that can advocate for change. I mean, it's a tool for empowerment and advocacy in some way. Still on the method of photo voice, just to give a brief on, I'm not able to give the whole process, but I would like to just highlight that for the photo voice method, we trained our participants, the mothers and the fathers, on the study objectives that we would like to learn from them, what healthy father engagement looks like. So we taught them basic photography skills, ethics of photography and research. We gave them prompts to guide them in taking the photos. And for those that did not have a smartphone, we provided a study smartphone. Just to highlight the procedures that are involved in this methodology. So they will take photos. In our study, they actually took 10 photos and only selected 5 for group photo discussion. And as I mentioned earlier, this is quite a participatory method. So they arrive at initial themes. They bring the photos, they discuss the photos, and then they arrive at initial themes. And so the themes that I will share later on in the presentation are actually the themes that the participants themselves arrived at. I wanted to quickly share a sample of the prompts that we gave the fathers. So this prompt is what guides the participants on, what photos they're going to be taking. So the fathers will were asked to take a photo of what being a father means, what it means to provide, their biggest challenges, what helps them to be better fathers, and the support that they need. Mothers were given similar set of prompts, just slightly differently worded. To the results from the photo voice process, we begin with this first photo. And as the participants took the photos, they also, narrated the photo. And in this group of fathers, we've only had one group of fathers and two groups of mothers. So those are the results that I will be sharing. This father defined fatherhood basically as being close with his children to understand them, understand their needs, and so that he can raise them in the best way possible. And this photo, he says it's of him, as you can see, walking with the children. They're going to the shop. And, he says that he actually has a very close bond with these children. And for him, fatherhood means being close with the children. This is from the first mother's group. And this is the definition of one of the mothers on what fatherhood is. She took a photo of her son and his father walking to school. And she said she's very happy that the father of this child not only provides for the family by paying for the education, but he actually goes beyond, providing the financial educational need, and is involved in the child's life. Talking about fatherhood challenges, this is a photo from one of the mothers in the second group. And this photo is one that highlights the challenges of fathers. Fathers are primarily seen as the providers of the family. And so if the father does not have work, does not have an income, it becomes very challenging. And that's something mothers were keen to highlight. Another challenge from highlighted by a mother. So she took this very interesting photo of fathers sleeping on their motorcycles. I hope you can see that. And, they are patiently waiting for customers. She said some of them actually have left the motorcycles there and probably gone to do other things. And she said she felt sorry for these fathers because if they don't have an income, then it's going to be very challenging to provide for the families. From the fathers group, we had another perspective on challenges. And in this photo, this father describes the challenge of, not being able to be present to spend time with his son, and the risk of other people influencing his child in a way that would contradict how he wants to raise his child. So he says this is a photo that represents, it's a photo of adults working with children, representing extended family members. And because he's away from home for long hours, then he doesn't have time to he doesn't get adequate time to spend with his son. And his biggest fear is that other people will influence him in a way that negates what he's trying to do in raising his child. When we talked about the things that can, the strategies that can help make fathers better, one of the mothers groups, a participant in the second mothers groups, shared this picture, and he said this is a picture of, a man and his wife in their workshop, and the man is the one that is working, but the wife is present to keep him company. And she feels like this is a good way to maintain a healthy relationship between the two of them, because while she's sitting there, it's a motivation for him. And she said this picture makes her feel good about, about this kind of family. Another participant in the mothers group also shared this photo and said another important factor in, making something that makes fathers better is spiritual values. So in this photo, she says, this is my husband reading his Bible, and the Bible does provide spiritual and moral guidance. And, the Bible can change a person's bad habits and can make fathers better. This is from the fathers group. So one of the fathers shared that this is, engaging in religious activities such as attending church, enables him to, pray and get help from God in how to lead his family. From the mother's perspective, one of the mothers in the first group shared this photo, and she says this is a photo of a mother who owns a small business to supplement family income. Even though fathers are providers, they need support from their wives because times are unpredictable. And so this is a way that mothers felt the fathers need support. While they're the primary providers, they too need support. This is a photo without a caption, but in this photo, the father who shared this photo actually said that, just like the mothers have identified that probably one family income may not be able to sustain a family. So this father expressed, the desire to be able to get support in terms of maybe getting another job, because he says he is sitting here and trying to, figure out how he would sustain a family on the income that he currently has. And it's very difficult to really budget and, sustain the family before the next paycheck. I would now love to share the themes. Like I said earlier, these are the themes that the one group of fathers that have completed the photo voice process shared with us. And so in talking about fatherhood, they actually said there's more than just financial provision. There's guiding the children, role modeling, leading the family, providing emotional support. And while fathers, work hard to provide for their families, they also are aware and they do strive to be emotionally available, support the education of the children. We had photos of, fathers helping children do homework, and they also want to be really present in the children's lives. On challenges, as the photos had highlighted, the father said one of the biggest challenges is the financial hardships, joblessness, and balancing the pressure to provide for the family while being present to guide the children, be present to guide, to role model, and be present in the children's lives. Fathers felt that they can become better through spiritual influence, self-reflection, and having open communication with their partners. Still emphasizing the need for, the financial, the job opportunities, but they also added that they need to support each other with their partners, both emotionally and working together towards the family income. For the two mothers groups, this is how they summarize the themes. And we had a lengthy discussion on what a good father really is, or what is the definition of a good father. So a good father, according to the mothers, the two groups, is one that creates time for his children, provides for the family, and supports the wife. They were also in agreement that, religious values and mentorship, say from older fathers, would strengthen the parenting skills of fathers and also help foster healthy relationships with their partners, who are the fathers of the children. And this would, positively impact fatherhood. In terms of challenges, they were also cognizant of the fact that fathers do face a tough task in terms of providing for the family. And in some families, there's lack of support from the partners. So they said the fathers do need financial support and emotional support from their spouses. We would like to summarize these findings as, fatherhood really feels like being responsible for everything, providing stability for the family, providing financially, physical needs of the family, emotional needs, and that healthy relationships between couples do impact fatherhood. Therefore, couples need each other in terms of emotional support and shared financial responsibilities. There is a challenge in fathers face the challenge of, balancing, providing for the family, and coping with, what's expected of them that they're not able to meet, which includes being present to raise the children, being present to guide the children and, provide family leadership while working hard to provide financially for the family. I would like to conclude by what the father said. The photo voice exercise was quite empowering for the fathers. And I would use this kind of lengthy quote from one of the fathers, because one of the things we talked about during the photo discussion is the overall experience of, taking the photos, thinking through the, the prompts. What is fatherhood? What are the challenges? So this is what one of the fathers said. I never knew such things were needed in life. And such things means taking photos and having discussions on fatherhood. So he never knew such things were needed in life, and a place where I can go to express them because it has been hard. Others, meaning the fathers, don't have parents and are insecure to express those things to someone because of mistrust, the community, and the role of fatherhood. Because most men think that they're always right in their role when it comes to supporting their families. Things might go wrong, and we may need support from others, not only from family members, but from the community in general. And I would like to acknowledge the whole qualitative team for their support during this process. Thank you.
Thank you, Helen. That was an amazing presentation and a much needed discussion. It's so heartwarming to see fathers being vulnerable and opening up to this process. I'd kindly like to request, if you have any questions, don't forget to put them in the Q&A section. We shall delve into a bit of a discussion after this. And now I'd like to welcome our second presenter. We'll cover all questions from the two sessions at the end. Our next presenter is Dr. Michelle Bulteris, who is an epidemiologist and assistant adjunct professor at the University of California, San Diego, specializing in maternal, paternal, and child health among families affected by HIV in sub-Saharan Africa. Dr. Bulteris' research is primarily based in Kenya, Botswana, and Uganda, and focuses on caregiver relationships and mental health, further engagement interventions, and child neurodevelopment. Welcome, Michelle. It's a pleasure to see you.
Thank you so much, Maureen. And thank you so much, Helen, for a really outstanding and beautiful body of work. So even though I'm now at the University of California, San Diego, I actually come from University of Washington. So over the last 6 years, I've been really lucky to work with many of the folks who you've been listening to in the symposiums throughout the week. And so it's just been really exciting to see all the work that this group is coming out with for the Mind Symposium. So today I'll be talking about the follow-up of what Helen presented from our qualitative and photo voice studies. What can be done next? How can we actually reach fathers? How can we create and adapt and implement evidence-based interventions to improve outcomes for families? So we know that fathers' voices have been neglected for many years in both the child development research space as well as in our fight against HIV. And in recent reports, both UNAIDS and UNICEF, so two agencies as part of the United Nations, have really acknowledged very vocally the importance of reaching fathers and elevating their voices to promote father engagement. And from what we learned from Helen's presentation, we see that fathers face very high pressures. There are societal expectations of them, social expectations of them to be the heads of the family. And as Helen shared in the presentation, fathers are also feeling that it's their responsibility to almost provide everything for the family. And whether that's the case or not, it is a very high amount of pressure on fathers, which can impact many things within the family. And challenges that can arise in life, such as poverty, unemployment, food insecurity, or even HIV or HIV risk. These things can threaten men's perception of their value in their family and also their engagement. And this remains a very challenging and complicated issue to address. But what research does tell us over the last several decades is that healthy father engagement has a very important role in improving caregiver relationship stability and satisfaction, reduced household violence and food insecurity. It can really improve maternal physical and mental health. And it also improves fathers' physical and mental health. It has shown to improve child survival rates. And this includes in families affected by HIV, where maybe mother is living with HIV, father engagement actually improves HIV-free survival as well. It improves child neurodevelopment, as well as child school attendance, so the proportion of children who attend school, and how well they do in school. And on a broader note, healthy father engagement at a community level can transform gender equity within communities. So if we were to put this into visual format, here's a conceptual model that we can think of. So right now in maternal child health research, a lot of the times we have a really good idea of the mother, the child, and the community, but there is still a missing puzzle piece, and that's the father. And the father, as we know, plays such an important role in the family, whether it's through decision making or resource provision, or other circumstances within sort of the family environment that a mother and child are in. So it's really important to not ignore this missing puzzle piece that's so important. And there are father interventions that we can adapt or that we can create that have multiple mechanisms of change. And I won't go into the variety of mechanisms of change, but actually, we're about to publish a paper in the journal called Pediatrics, which goes a little bit more in depth on what kinds of mechanisms of change that these father interventions can accomplish. But ultimately, our goal is improved outcomes through the father. And if we think about the mother, father interventions can improve the mother's physical and mental health. And in terms of families affected by HIV, father engagement, can improve increased support, treatment adherence, possibly sustained viral suppression has been shown in a few studies, and also a sense of security and stability, which is so important for mothers going through antenatal care and postpartum care. And then for the father, engagement improves many outcomes for the father himself, physical and mental health, parental self-efficacy, so his confidence in his ability to parent, his sense of purpose and value in the family. And also, we've seen that father engagement in maternal and child health can also improve uptake of men's HIV testing and health services. So we see a reduced stigma for attending health services. And then it also has this powerful role in improving relationships. So through father interventions that really target relationship stability and satisfaction, that target reduction in household violence, and target shared decision-making and responsibilities, it's really molding this bond to be stronger between mother and father. And then that has a big role on child outcomes. So we see improved birth outcomes, HIV-free survival, growth and nutrition, healthy neurodevelopment, parent-child attachments, emotional regulation, and equal gender socialization. So the differences in how sons or daughters are engaged with their parents. And sort of that final piece of this conceptual model is, what does this mean for the community as a whole? As a whole, from father interventions, we see reduced gender-based violence, not just within families, but across families, across communities as a whole. We see family and social cohesion, gender norm transformation, reduced HIV stigma, peer support systems, higher HIV testing among men, which actually has a much more bigger impact for the community, improved maternal and child health indicators, and more family-oriented services that actually speak to men and not just mothers and children. So I want to acknowledge some of the outstanding work that our research partners and our research participants have engaged in throughout the MIND study over the last several years. We have met to discuss intervention priorities and also study clinic observations, and we've held multiple focus group discussions with mothers and fathers to really understand what are the most important components that need to go into an intervention. And we got multiple important quotes that indicated that there's a high demand for father interventions. We already know this, but to have data to support it is even better. A mother in Kenya here on the left said, "Please bring our husbands here and teach them what you are teaching us." And on the right, a father in Botswana told us, "We want to learn how to be good husbands to our wives and fathers to our children." So what are fathers telling us that they want support with? How are we defining father engagement? Historically, fathers have been invited to engage in partner HIV testing during pregnancy, to accompany their wives to clinic visits during pregnancy, but fathers are telling us they want more involvement than that. And actually, those kinds of things are deterrents for their involvement, whether it's due to HIV stigma or work constraints, time constraints. They're often unable to accomplish this, and it actually holds them back from being involved in the ways that they do want to be involved. Fathers also are telling us, and this is touching back on what Helen shared with us, but fathers need financial support. They tell us that it's crucial for household stability and empowering men to fulfill their role as a father in the ways that they wish they could or hope they can. Healthy partner relationships is critical. Fathers say that the strong marital communication is essential for both financial and emotional stability within the couple. And lastly, fathers are telling us that they want emotional and practical fathering guidance. They highlight the impact of having either a positive or absent father in their own life, and how, if that's their only example, they don't know how to promote child's development, how to encourage their children to be independent, and also regulate their emotional well-being themselves. So if fathers are telling us that they want these interventions, mothers are telling us they want these interventions for their male partners, where are these interventions? Where can we find them? And we have a variety of different options. So we can implement proven interventions to maximize their impact. And I'm actually later on in my talk, I'm going to share some examples of interventions that already exist in Kenya, Uganda, Tanzania, many countries around the world, and in sub-Saharan Africa that we could scale up bigger to reach more men. Secondly, we could adapt some of these interventions to fit new cultural contexts. So maybe there's an intervention in Rwanda that has been so successful, maybe we can adapt it for a population in Kenya. And lastly, we could design new interventions. We never have to stop there. We can always co-create with community members to make sure that interventions that are new really, really are tailored to meet their needs, which might not be the same needs as fathers in a different context. So we have a lot of different avenues that we can take. And ultimately, the main point I hope that my presentation that you can take away is that we rarely need to reinvent the wheel. Whether we're creating a new intervention or we're adapting something or we're just implementing something that's already proven in another context, we never have to reinvent it. So I really love this cartoon of a man sharing a perfectly good wheel And the other two are saying, no thanks, we're too busy. And they're using a square wheel. So that's how I felt. And now I want to share a couple of the evidence-based interventions that have been acceptable, that have been successful in other settings that maybe we can learn from. So one is called Sugira Muryango. It's based in Rwanda, and it's a family-focused home visiting program that promotes positive parent-child relationships. It fosters healthy child development by targeting children's physical, cognitive, language, and social and emotional development. And this is as I said, a home visiting program that is intended to strengthen the family and reduce child disciplining that is physical, so physical violence in the home. This is a screenshot I took from their video explaining all the benefits that Sugira Moyango has had. And this has significantly shown to improve child neurodevelopment in all these different domains. It has also shown to improve father readiness and confidence in themselves, healthy child interactions, and reduction in violence. So it's been so successful that now Rwanda has invested Ministry of Health funds to scale this up to reach more fathers in the country. So this is one example. Another example comes from Tanzania. So this is the EFFECTS study. It stands for Engaging Fathers for Effective Child Nutrition and Growth. So this is a bundled intervention that is aimed to reduce father stress and also provide father training on what are the important components in the early years of a child's life that will improve child's nutrition, their nutritional diversity, and their development. And in development, we mean growth and neurodevelopment. And this intervention has shown to significantly improve all of the outcomes that they aim to improve, including father mental health and confidence. Another one I want to highlight is called SMS for Dads. This actually is a very evidence-based intervention from Australia that has been rolled out to more global settings. Two of them have been rolled out in Kenya and in Colombia. So Bogota, Colombia. So very, very far from Kenya. But it's interesting that this intervention has shown to be successful in so many different parts of the world. This is an SMS intervention, so it actually sends brand new fathers short text messages in their first 6 months as a parent. But it actually starts a little sooner than that. They start texting the father about 3 months before the child is born to just mentally prepare the father for this new step in his life. And for the first 6 months as a parent, it provides fathering guidance, but it also allows two-way text messaging. So if fathers have questions, concerns, fears, questions about something that maybe their child ate, whatever it is, they feel like they have that social support now from this intervention. Okay, so I'm actually going to spend a little bit more time with the example on Real Fathers. Real Fathers stands for Responsible, Engaged, and Loving Fathers. This intervention is being rolled out in Uganda, and it's funded by the Lego Foundation. So if you know the little Lego toys that can create blocks, that foundation is so interested in child neurodevelopment that they actually are funding research that improves child development. And they feel that going through fathers is one of the best ways to do that. And so I'm very lucky at the University of California, San Diego, we actually get to work on this project. So I've been working on this project for about a year now. And I want to spend a little bit of time talking about this one because I think it uses a very unique and important model that maybe we could use in Kenya as well. So this model is called a father-to-father mentorship model. Fathers who are young fathers, which there's a reason why they selected young fathers in Uganda. They wanted to reach men who would be more amenable to change or to maybe transformation in how they look at gender roles, their expectations in the family, and how they engage with their children. So this often reaches new fathers or young fathers under the age of 25. And the father-to-father mentorship piece, when new fathers come into the intervention, they are asked to identify another father in their circle. So it's not someone who the intervention comes up with and says, this person will be your mentor. The fathers get to select their mentor fathers. So that can be their pastor, that can be their friend, their uncle, their own father. It can be their community leader. It can be anyone who they trust. And then the mentor fathers who are then selected, they go through a training. And that training teaches many different aspects of fathering. And then the mentor fathers provide this training to their mentee fathers. So those target fathers who we're reaching, they're the ones reached through these mentor fathers. And this model actually uses a 7-phase curriculum. And each phase of the curriculum is given within a month. So this program is 7 months long, and each month they go through a different topic through group visits. They get groups of fathers together and they discuss these curriculum items, but they also have home visiting services to check on the fathers and see them where they are. And this covers fatherhood in general, fathers' visions, their goals in life, how to be a real father, responsible, engaged, and loving father. They talk about family dreams, how to manage the pressures of being a father, how to love the family. And then I put hearts on the 5th, 6th, and 7th curriculum item. This study has been going on, this intervention has been going on for several years. And as time goes on, we've learned that mothers want to be part of this. They want to know what their male partners are being taught. They want to be a part of this family intervention, not just a father intervention, but a family opportunity. And so the last 3 sessions are with the mother included. So it's about couples exercises for teamwork, listening, showing respect. It talks about family planning, teaches couples about how to make mutual decisions and the timing of having children and how many children to have. And then lastly, it ends with couples exercises to establish parenting goals, agreements, and commitments to each other and to the child. So this intervention has been so successful over the last 5 years that now they're partnering with the Ministry of Health, Ministry of Education, and Ministries of Community Development to enhance this and scale this up to broader communities across Uganda. So I had been very inspired by this intervention, and I'm hoping to now adapt it. So I received funding from the University of Washington Center for AIDS Research in a new investigator award, and I'm calling it SHARP, Study of Healthy and Responsive Parenting. And the aim of my study is to adapt the Real Father's intervention, but now for families affected by HIV in Botswana. And this will require a couple different adaptations. One, I'm going to need to adapt it from the Uganda context to the Botswana context. These are very different cultures. They view marriage and fathering actually in very different ways. And so that's going to require a lot of careful and thoughtful time to do. And then the other adaptation that this will require is to adapt it for families affected by HIV. In Uganda, it's reaching families regardless of HIV. They're actually not even asking about HIV out of fear that it might deter men from engaging in the program. But I want to reach fathers affected by HIV as they might have specific needs within their families that are not being met by other interventions. And how can we do that? So for this work, I'm working with UC San Diego, University of Washington, of course, and the Botswana-Harvard partnership to accomplish this work. Additionally, we're trying to understand preferences of women. If we reach women through antenatal care, and maybe that's one of the best ways, most promising ways that we can reach men who are becoming fathers for the first time, or maybe men who are becoming fathers of multiple children. We want to reach men through women if that's an opportunity. But in order to do that, we need to understand the preferences of pregnant women who are attending antenatal care. So we have a study led by Gillian Pintai, which is based in Kisumu County in Kenya. This study is reaching 3,000 pregnant women who are attending antenatal care, and we are asking them some questions about father engagement. So far, we have data from 472 women who have responded so far, and 99% of women believe that father involvement is important in raising a child. The topics, if we were to develop an intervention, the topics that mothers want us to cover include pregnancy and delivery, child development, and parenting skills. 80%, so the majority of women, say that their partner would be more likely to engage in a fathering program if it incorporated sports. So that's something to keep in mind. 94% of women said that if such a program was offered to them, they would want their partners to be invited to it. And we also asked who should invite these men to these programs. 49% of women say that they would want to invite their partners to a program, and 51% said that it's the responsibility of the healthcare worker to invite men. And maybe it would come with a little bit more credibility because it's coming from the clinic. But it's 50-50, almost half-half of preferences. So I think it's important that we offer this as an option, whether women want to invite their partners or if they don't want the responsibility on them to bring their partners in, and maybe a healthcare worker invites the partner to a male intervention. So I've loved soccer my entire life. I've played soccer my whole life. And when I asked that question in the survey about whether men would be more likely to engage in an intervention if it included some sports-based activities, I have always sort of dreamed of creating an intervention that involved soccer for fathers. And this might be a possibility. So, soccer could be a powerful platform for engaging fathers. It is a beloved sport. It's something that fathers are already telling us that they're doing. So, I want to share some photo voice data from also the study that Helen led. But this is a little different from what Helen presented because this is focused on the power of soccer. So this father tells us, if my child wants to play football, we play together. There is a lot of communication. If he passes the ball between my legs, it makes him very happy. He might say things like, Dad, I passed the ball through your legs. This interaction brings him joy. And not only is this an opportunity for bonding, but it's an opportunity for children to develop their communication skills, their gross motor skills, and their sense of emotional joy. So this is a picture from our photo voice study from a mother. She said, this is a picture I took while he was playing football with our child, meaning he loves him. This promotes fatherhood in the sense that he loves his kids and he is playing with them. This father tells us, I am a fan of football. So when I am home watching football on TV, my son becomes interested in the game. He sees the football and wants to play with a physical ball. We have a field where we go outside and play together. This is a photo of a playground in my neighborhood. This is where I spend a lot of my free time playing with my son. This is what I do to care for and support my son. So in our Kenya study called HOPE, we saw that from Mother Report that there was actually quite low percentage of fathers who played with their children. It's one thing to provide financially and provide housing and provide support for children, and it's another thing to play with children. But among the fathers who did play with their children, as we see from these quotes here, many of them use soccer as a tool to bond with their children. So maybe this is a potential path forward. So I proposed a study called KICS, called Kindling Involvement with Children in Kenya Through Soccer. This grant is currently under review at the Thrasher Research Fund, and I really hope that it's funded because I think it's an innovative and novel and potentially powerful idea. My goal is to co-create, work with fathers to co-design a sports-based fathering intervention that promotes early childhood development and early father-child bonding in those earliest years. In order to make this work possible, I'll be partnering with experts at UC San Diego who work on the Real Fathers Intervention in Uganda, as well as Drs. Grace John Stewart and Cyrus Mugo from the University of Washington and Kenyatta National Hospital, and an organization, some of you might know it, it's called Grassroots Soccer. It's a non-governmental organization originally from Zambia, but now they are based in many countries in Africa, and they deliver health and HIV prevention education through soccer. So I'm partnering with them if funded, we'll partner with this group to teach us how they can use soccer to deliver evidence-based information. So some last considerations. This is my last slide here, and something that maybe you in the group can help us learn. How can we best accommodate fathers? We hear that fathers want male peer-led interventions. They want it in the community setting and not in a clinical setting. They want flexible hours, perhaps on evening times or on weekends because of their work constraints. But how can we make these interventions attractive enough to engage men over time? And when we say fathers, I don't just mean biological fathers. I'm really capturing father figures. And how can we reach more men who are not just biological fathers, but maybe are playing sort of that role within families? How can we navigate gender norms? So there might be different expectations that we see between how a mother and a father plays with their children. But additionally, there might be differences in how fathers play with their sons versus their daughters. And because this world of research is still growing, these are some of the questions that I have that I would love, guidance on. And one consideration that I want to note here is that we might be reaching a biased sample of men in these programs. So the men who enroll in these programs might already be more engaged in their families than the men who are choosing not to engage in these programs, or maybe who these programs are not even reaching those fathers. So how can we reach the fathers who are hardest to get to, who might need these programs the most? And lastly, when thinking about father interventions, I never want to forget about the mothers who don't have that partner in the family. So single mothers, or maybe mothers in unstable partnerships. How can we also support them through these interventions? Perhaps maybe these interventions can still be useful to reach other men in her circle, maybe her father, her brother, her friend, who might be able to still provide some of the benefits that these interventions deliver to fathers. So that's where I'll end here, and I want to thank our outstanding research teams across different countries, thank the funders who make this work possible, and thank you all for taking the time out of your busy schedules to hear about fatherhood, and we really look forward to your input, your expertise, and guidance as we still navigate the next few years of where this research could go. Thank you, Maureen.
Thank you, Michelle. Yeah, that's another very beautiful presentation. I could listen to both of you talk about fathers all day, so I don't think we had enough time in this short time to cover everything that could be talked about fathers, and they do deserve the time to be talked about because as you've seen, many fathers are willing to be part of taking care of the children and being active partners in their children's development, but there is a very big gap and many don't know how to engage with them. I've seen a question in the chat, and it's one that I also had in mind. When in your study in Kisumu, when or rather Gillian's study, what are some of the reasons as to like who should invite the male partner? It seems in as much as in our photo voice there was we talked about communication and openness within partners in the couple. But it seems that there's not as much openness when it comes to suggesting that kind of involvement, even though we do see that men want to be involved. So is there something that we're missing? Is there a gap that perhaps we're not seeing?
I think that that finding where half of the women said that they would want to connect men to interventions, and half of the women said that they would want someone else, a counselor, a healthcare worker, someone from the facility to connect their male partner. I think it really speaks to the need of having options. Because relationships are fluid, relationships change all the time, and at times, at certain times, a mother might feel very confident telling her partner about an intervention that she would like to connect him to. At other times, mothers might not feel comfortable doing that, and maybe she knows that her partner will resist it or question, why are you telling me about this? Or maybe there would be more confidence from the male side if it came from someone from the facility that this is a evidence-based intervention that we are rolling out, and this is a real program that we would want you to be a part of, that we are inviting all male partners to, rather than just you through your wife. Maybe it'll make men feel less singled out, and that this is a credible program. I believe those are some of the concerns of some of the women. However, many of the women who want to be part of that invitation to their male partners are because they want to be part of the program as well. So one of the other questions that I didn't have time to get too much into it, but I'll mention here. One of the other questions I asked was, would you prefer to be in a for this intervention for fathers, would it be best if fathers were in one-on-one sessions with a facilitator? Would it be best if fathers were in group sessions with men only to sort of create that social support for men? Would you prefer couple sessions, or would you prefer group sessions with couples? And across the board, mothers preferred group sessions with couples. They wanted to be part of the fathering intervention. And that's actually what we learned in the Real Fathers Intervention in Uganda too, that over time, mothers were coming and saying, "What are you teaching my husband? We want to be part of it too. We want to learn too, but we also want to get closer to our partners through the program, and we can parent together after we leave the program." And so I think that that's a really beautiful sign that we're seeing that also in our survey in Kisumu. And it's something that as we move forward with father interventions, we have to keep in mind. And I think that was a big reason why a lot of mothers wanted to be the one to bring this information to their male partners as well. But because we don't always know the state of relationships, we don't always know how comfortable women feel bringing that information. And I think it also really depends on what the intervention is. If the intervention is to bring the male partner in for HIV testing, I don't think a lot of women are going to want to do that. But if the intervention is, hey, this is a couple's intervention to improve and strengthen the family bonds, then maybe that's something that everyone can get on board with.
Yeah, that's very true. But I also think that it's quite important for men to have a space that's their own. And that's something that came out strongly in the photo voice, having a space where they can talk without the fear of looking vulnerable, and have someone else to talk to who probably wouldn't judge them because they're also fathers. So in as much as couple interventions sound fantastic, I think but I'm not trying to speak for men. I suspect that they would probably want to have a space of their own where they could talk. There's another question on, and perhaps I can throw this one to Helen, how to overcome challenges when reaching out to fathers. I know in Hope's Photo Voice, we tried to include male recruiters and male interviewers. And there was a sense of enthusiasm at the end of the process, but how was it in the beginning? Were they actually enthusiastic to be involved in a study involving fathers?
Thank you, Maureen. I would say the first So first we started with the FGDs, and we had a lot of trouble getting the fathers. And I think, as Michelle mentioned, when you're thinking about father engagement, you have to have flexibility in mind, because they will not show up on a weekday. And even if they show up on a weekend, their time is often limited. In fact, some will leave the group and say, oh, I need to go to work. Oh, we need to keep time. So unlike mothers, with fathers, the program or the intervention lead would need to think about a lot of flexibility on your part, because their availability is limited. But when they come, they are present. That's what I would say. And it was very encouraging to see their participation in Photo Voice, and the fact that they felt it was not as challenging. In fact, mothers in the Photo Voice groups, the two groups, felt it was, they had a lot of logistical challenges, finding time to take the photos, having, if they wanted to take the photo of the male partner, having to explain why they need to take the photos. But for fathers, it was all easy, save for, their availability. And when they show up, they want to show up on time. They want to show up in a very organized manner, and they want, to really engage as agreed. So I think while it's initially hard to get them on board, for the majority, for the few that are already engaged, say in, attending the Well Baby Clinic, and are already aware that, say, like in the case of the Hope study, that the child is in the research, the child and the mother are participating in the research, then they're more flexible, but it's not easy to find them. So it calls for a lot of flexibility. But when you do find them, then they're very engaging.
Yeah,
Thank you, Maureen.
Thank you, Helen, and thanks for pointing out that these are fathers who, like Michelle said, we are probably talking about like a very biased population, because these men have agreed to be part of the healthcare system, part of research projects. So yeah, it will be very interesting to see what fathers in the larger community are thinking about this. And just going back to the initial activity with the stickers and the nurturing care framework, it was very interesting to see, especially like to you, Michelle, the differences between what the fathers in Botswana thought and the fathers in Nairobi. And I know we talked about like the difference in ages contributing to what some of those stickers were, but was there anything else in the differences in the family organization or interaction that probably may have led to this?
Yeah, that's a really great question, Maureen. I think that the ages of the children is really important. So in Botswana, the children in our study were 6 months old. So the caregivers were really focused on breastfeeding and making sure that they're, bringing their child in for postpartum visits. But then in the Hope study, our children were about 3 years old. And so parents were thinking more about providing for the child, giving the child opportunities to learn. And financial insecurity was something that came up quite a bit, as we saw from Helen's presentation. Something else that was very interesting when comparing the demographics of our two populations, and this is something that I think is going to be very important when I'm adapting interventions for Botswana, is that in Kenya, we have very high marriage rates. So in our population, I think in the Hope study, I hope I don't say this wrong, but I believe we're over 90% of the couples who we have in our study with children are married. Is that right, Maureen? I think you might know better than I do.
Yeah. So it's actually a little different for the mothers who are living with HIV. For them, it's about 70%, 75% of them are in a stable relationship, while for those who are unexposed, over 90%. Yeah.
Yeah. And then in Botswana, less than 10% of the population say they are formally married. That doesn't mean that they're not in stable relationships. Many of them are. Many of them have many children with their partner and they live together, but they're not formally married. And so there are a couple different cultural, social networking constructs that are very different across countries that I think we have to first pay a lot of attention to and understand before we can make too many conclusions on comparing the country data. But I think that this work that Helen had completed, with the stickers across both countries, is a really great starting point. So we can at least explore how can this nurturing care framework be understood in different contexts? What are the biggest challenges across different contexts? And what kinds of interventions would be most useful for each group?
Thank you. And for Helen, we noted that there's a challenge with what fathers, like how fathers think they can play with their younger children because they're on provider mode a lot of the time, and they're socialized to think that a good father is a father who goes out and brings in food and provides safety and security. But did they give any insights as to how perhaps they think about play with a child younger than 3?
I think we see a few fathers talking about some of the fathers that Michelle highlighted from the photo voice that talked about, soccer. And there's a whole component on storytelling that we did not share in this presentation that, fathers, we spoke to fathers about how do they, not so much playing, but how do they bond with the children, and talked about specifically, do they tell stories and do they act out those stories with children when they're telling the stories, children about, say, animals or, different things. And we did see that that was quite something for the fathers because they do, they tell the children stories as a way of bonding and also as a way of teaching them different things. Their lessons drawn from the stories. And they are also, it's an enjoyable activity when they act out. I am a certain animal, and so I am going to be animal A, that's the father, and the child is going to be animal B. And, that kind of play, and that was important. And I guess because we directly asked that question, we were able to engage quite a bit on it. From the photo voice, we didn't hear so much about playing. I think we did hear bits and pieces of, taking the children to places, what Michelle shared about playing soccer because the father is also interested in soccer, going out to the neighborhood, open spaces and riding bicycles with children. And importantly, because we can't highlight everything, I remember on top of my head, one of the fathers in the photo voice group talking about the challenge of finding those spaces, especially within Nairobi, and spaces that are free, because most of the, recreational spaces in Nairobi are, at a fee. So they did highlight that, maybe not too much, but at least there's something going on, both from, the aspect of storytelling, acting out stories for, to entertain the children, to teach the children, and also playing as, physical activity, be it football or riding bicycles and things like that. Yeah, but we can dig in a little more into the data and see what other things did come up. And thank you for asking that, Maureen. Thanks.
Thank you. And last question to you, Helen. Did the issue of gender-based violence and intimate partner violence come up?
Not as much, and I want to speak maybe from the father's perspective when we explored relationships. And one of the things I remember, and we have had this conversation with Michelle, the father saying, everything stems from, I just want to pull it out and read what exactly they said. The reality is that many issues stem from financial instability. So while they said I think the father's conversations are a little more fresh in my mind. While they say that, there are small misunderstandings in the relationship, they actually amplified the fact that the reality is many issues stem from the financial instability. I would need to think a little bit about, what really came up from the mothers. I don't know, Michelle, if you have that on top of your head or something you'd like to comment.
Yeah, interestingly, I'm with you, Helen. I actually don't think IPV and gender-based violence were brought up that much in our qualitative and photo voice study. I don't believe we asked specifically about it, and it wasn't raised often. Um, so I think it's an area that we really need to, pay more attention to and explore further in our next studies.
Thank you. I think we just have 3 minutes left. I think the other overwhelming request is because you have two very popular presenters, everyone would like to know how they can reach you. So maybe you can provide an email address on where they can reach you.
Sure. Would it be best to, I'm trying to think the best place to type it in.
I think that would it be in the chat? And the other thing that we'll do is on the poster, the invitation poster, there was a link to the Mind Study a website, and we can provide contacts for the presentations that have been done in the course of this week, in case you need to email any of the presenters, and at some point also link the presentations that have been done, the recordings of the presentations that have been done.
Yeah, absolutely. Thank you for your amazing job as facilitator and moderator of this session, Maureen.
Thank you. I always like working with the two of you, and working in Hope has always been a pleasure. It's been very exciting thinking about child development from very many different aspects. Yeah, and we are glad that we got to bring in everyone else. So I think that is all the time that we have. I hope you were able to put in your emails, Irene, Michelle and Helen, in the chat.
So
Yeah, I don't know if it's showing, but I did put in the email.
Yeah, I think you can also just say them out loud, and whoever is not able to access them in the chat can just note them down.
Go ahead, Helen.
Yeah, my email contact is Mora Helen. Helen is single L 38@gmail.com. Thank you.
And mine is MI and then my last name, which is hard to say. So it's MIBULTERYS at health.ucsd.edu. Also, if you Google me with UCSD, there should be a website where my email is posted as well. Looking forward to collaborations.
Thank you so much. Thank you, Michelle. Thank you, Maureen. Thank you, everyone.
Thank you everyone for attending. And again, if you want more information, we'll have a link to the Mind website on the poster. And we look forward to another exciting day tomorrow, where we'll have Dr. Brent Collette and Dr. Jaya Chandna talking about two brilliant child psychologists and psychiatrists talking about neurodevelopmental assessments and approaches and interventions. Thank you, and have a good day and good night wherever you are.
Bye.
Bye.